Good day, and thank you for joining us today, to each of the participants and all the delegates that are on this webinar. My name is Kumeshni Patrick, and I am pleased to be the host for today. I am from EndCode, which is a tech legal consultancy based in Johannesburg, South Africa. And at EndCode, we focus on tech law and tech policy issues. It's no coincidence that today we are hosting this webinar, as we thought it's fitting to mark the celebration of Human Rights Day by focusing on the right of access to information. The United Nations chooses a particular theme for each year, and for 2020, the theme is Recover Better, Stand Up for Human Rights. The theme relates to the COVID-19 pandemic and focuses on the need to build back better by ensuring that human rights are central to all recovery efforts. Today is an opportunity to reaffirm the importance of human rights in rebuilding the world we want, the need for global solidarity, and our interconnectedness and shared humanity. I'd like to just take you quickly through the agenda so that everyone can plan themselves accordingly. After this, we will have a speaker from CEPESA, who is Ashna Kalamera, who will share some background information regarding the topic under discussion today. Our topic for today is access to information in contact tracing databases in Botswana, Nigeria, and Uganda. And we're looking particularly through the lens of access to information regarding health. After Ashna speaks, I shall return to provide more detail about the topic and the work that we've done. And we'll include the research, the outcomes, and a little bit more about the toolkit that has been developed. Our panel discussion follows thereafter, which will provide an in-country and a sub-Saharan African view and discuss the legal frameworks around access to health information. We will host a Q&A session thereafter. And by then, I'm sure everyone will be most eager to view the toolkit that we're talking about, which comprises a video and a few posters specific to countries, and then one general poster that can be used. And after that, we'll just close the webinar. So without further delay, I would like to welcome Ashna Kalamera from CEPESA, who is our program manager for this webinar. Welcome, Ashna.
Thank you, Kumeshni. Good afternoon, everyone. Hoping that we are all in the afternoon time zone. My name once again is Ashna Kalamera, and I work with CEPESA, which is the Collaboration on International ICT Policy for East and Southern Africa. We are based out of Kampala, Uganda, but work across the continent in advancing ICT policy, but also its practice or its use that advances human rights, good governance, and improved livelihoods. Our work areas include research, capacity building, stakeholder convenings, as well as advocacy and awareness raising. Within our capacity building strand, in April 2019, we launched the Africa Digital Rights Fund, also known as ADRF. ADRF works to support organizations and networks to implement activities that advance digital rights, activities such as advocacy, litigation, research, policy analysis, movement building, digital literacy, and digital security skills building through flexible and rapid response grants. The most recent round of ADRF, which was the third issued mid this year during the pandemic, is in line with the theme of Human Rights Day today. The round focused on COVID-19 response measures and how they affect the internet rights landscape on the continent, and how to redress any harms to rights and freedoms that have resulted from the pandemic and government responses. Efforts related to the digital rights landscape in the context of COVID-19, we feel are essential because even in pandemic times, governments as well as non-state actors must respect human rights and not abuse the emergency powers that have been passed in many countries. Furthermore, many actors need access to credible information and research to inform their work on awareness raising and holding authorities, duty bearers, private sector to account during and in the aftermath of the COVID-19 pandemic. Since its launch in April 2019, ADRF has supported 33 initiatives with a total sum of $355,000 US. And we are really pleased to have EndCode as one of those 33 initiatives, awarded a grant to test the robustness of access to information legislation in Botswana, Nigeria, and Uganda. As part of their work, EndCode is exploring protocols around access to critical information collected by governments in COVID-19 contact tracing databases. The outputs of this effort by EndCode aimed at promoting awareness on the link between access to information and the right to health. This is particularly relevant in the present COVID-19 pandemic context, but also future work and engagements with duty bearers on the right to access to information, not only in the public health context, but also broader public information. Access to information, of course, being a key human rights that sets the foundations of many other rights, be it freedom of expression, association and assembly, as well as the right to privacy. So we're really happy to be we're really happy that EndCode is hosting this dialogue on Human Rights Day, and that the theme of Human Rights Day is directly in line with the work that EndCode has done as supported by the Africa Digital Rights Fund. So we wish you very fruitful deliberations and look forward to recommendations and thoughts on how movements or advocacy around right to information in public health contexts can be realized. Thank you.
Thank you so much, Ashna. That was a wonderful roundup of all things that are relevant to this particular work that we've undertaken. I have promised to give you a brief understanding of the project it has undertaken. And let me start off by saying that in response to the COVID-19 pandemic, many countries across the world, including the selected countries being Botswana, Nigeria, and Uganda, adopted contact tracing protocols and mobile applications. And these responses were necessary measures for the means of tracking infections and ensuring that the government could make informed decisions regarding public health policy and making appropriate responses to the pandemic. It's broadly accepted that contact tracing plays an essential role in combating the pandemic. However, governments do have the duty to be transparent, open, and accountable regarding the collection and use of this information. The World Health Organization has emphasized the need for a human rights-based approach to health. And what that means is an approach to health that requires meaningful participation. I'd like to just read the definition of meaningful participation. It is participation ensuring that national stakeholders, including non-state actors, such as non-governmental organizations, are meaningfully involved in all phases of programming: assessment, analysis, planning, implementation, monitoring, and evaluation. This plays out in the sense of governments must allow civil society to participate in all phases and in all measures adopted. Governments and other parties must be held accountable when developing policies, conducting programs, and creating redress mechanisms for victims of health violations. In this regard, civil society organizations should have access to critical non-personal information contained in the contact tracing databases. In this way, they are able to hold government accountable as well as to inform local communities at a grassroots level regarding up-to-date information about the pandemic. EndCode has undertaken research and analyzed the right of access to information in the particular countries to determine the extent to which such organizations can access critical information contained in contact tracing databases. I will do a slide share now, just in order for us to view briefly the findings for each country. So the first finding relates to Botswana. You will note that Botswana does not have a freedom of information law, and therefore there is no legal right or process to request information from the government, public bodies, or private bodies. There is no direct constitutional right to access to information. The Constitution provides for freedom of information indirectly under the freedom of expression in Section 12. And there you will note that no person shall be hindered in the enjoyment of their freedom of expression, that is to say, freedom to hold opinions without interference, freedom to receive ideas and information without interference, freedom to communicate ideas and information without interference. There is no direct right to health, but with an interpretation of Article 12, citizens have the right to impart and express information pertaining to health. During the pandemic, Botswana passed 7 different regulations relating to COVID-19, and none of these instruments contain any provision that entitles a citizen or civil society member to request information from the government regarding the pandemic or any other health information. There is also no obligation on any such bodies to make this information freely available to civil society organizations or the public over the internet or otherwise. Our findings for Nigeria include: Nigeria does have a Freedom of Information Act, which is currently operational. In terms of that act, Section 1, subsection 1, establishes the right of a Nigerian citizen to request access to information that is in the possession of any public official, organ, or body. Section 4 states the public body in control of the information must ensure that it's widely disseminated, whether it is through print, electronic, and online means, or physical copies at the respective office. There is no direct constitutional right of access to information. The closest we can get to that in the Constitution is Section 39, which does state that every person shall be entitled to freedom of expression, including the freedom to hold opinions and to receive and impart ideas and information without interference. There is no direct constitutional right to health, but the government has adopted the revisioned National Health Policy under point 2.1. The development context states that health and access to quality and affordable healthcare is a human right. Nigeria adopted one set of federal lockdown regulations on the 30th of March 2020, and this was adopted in terms of the Quarantine Act of 1926, but neither the regulations nor the Act speak to access to information or contact tracing databases. A reading of the Act would empower civil society organizations to obtain information from contact tracing databases as long as those databases are in control of a public body. And then thirdly, for Uganda, we found that Uganda has enacted the Access to Information Act in 2005, which is read with the regulations of 2011. The Constitution has Article 41, which governs access to information, and every citizen has the right of access to information that is in the possession of the state or any other state organ, except where such information will interfere with state security or the privacy of another person. Uganda's legislation, though, sets quite a narrow ambit as it only considers the government as the information provider. There is no constitutional right to health, and government has adopted statutory laws to enforce the right to health. The COVID-19 regulations have had little direct impact on the right to access information. And neither the regulations nor the Access to Information Act speak to accessing information in contact tracing databases. Section 34 sets out mandatory disclosures if a disclosure would be in the public interest. This suggests that if the requirements in the section are met, civil society organizations can approach the government. As part of our work, we have had to create a toolkit for civil society organizations in each country to use. EndCode has developed this toolkit to assist in understanding the legal frameworks that affect access to critical information in contact tracing databases during a public health crisis. The toolkit comprises the video, which speaks to the human rights-based approach that's required for health. There is one poster per country and a general poster that speaks to the right of health and access to information. With this in mind, EndCode hopes the toolkit will drive awareness among civil society organizations on understanding the importance of access to information during a public health crisis and how this information may be accessed. This should enable the driving of advocacy in the form of awareness and understanding from a grassroots level, and create a move towards developing a more open and accountable public health system with informed multi-stakeholder participation. That rounds up the introduction regarding the work that we've undertaken. And now I know that we have our panelists waiting online who will join me in a short panel discussion relating to understanding what challenges they have encountered in each of their countries, and from our sub-Saharan Africa expert, we'll get an understanding of what the region has experienced during the pandemic. So please join me in welcoming the panelists for today. From Nigeria, we have Maxwell Kadiri. Maxwell is a senior legal officer at Open Society Justice Initiative. From Botswana, we have the pleasure of having Putsetso Morapedi with us. She is the executive director at the Botswana Center for Public Integrity. From Uganda, we have Susan Agwang. Susan is the legal and research officer at Africa Freedom of Information Center. And providing our sub-Saharan African perspective is Shlingiwe Dube. Shlingiwe is the project coordinator. She is from the Democracy, Transparency and Digital Rights Unit at the Center for Human Rights. Thank you to each of you for making time to be with us this morning and taking time to share your insights. Welcome.
Thank you. Thank you for having us.
So as we start this discussion, let me direct my first question to Shlingiwe. And Shlingiwe, I think it's great that you're here to kick us off and give us first a regional perspective before we dive into each of the countries. So I know in terms of your work, you generally gain quite a unique perspective on issues like access to information. And we'd like you to share with us how does access to information relate to human rights principles such as accountability and transparency for sub-Saharan Africa?
Afternoon, everyone. I hope you can hear me. Hello?
We definitely can hear you.
We can hear you.
Thank you very much. I just wanted to confirm before I proceed. So thank you very much for the opportunity to speak on this event, and I just want to say that yes, we do work on access to information issues at the Center for Human Rights, and specifically under the Expression, Information and Digital Rights Unit, which is a wing of the center that works on access to information, freedom of expression, and also digital rights developments on the continent. And I am happy to join this conversation and also advance the right of access to information through this webinar. Before I delve into the specifics of the question that has been directed to me, I just want to say that in terms of access to information on the continent, really, there is an active movement. How many minutes do I have?
We're not going to give you a time limit. It's fine. We're good for time at the moment, so please go ahead and share.
Okay, thank you. I just want to say that in terms of the movement around access to information, the movement is really growing on the continent where we sit today. I'm sure if you look at in 2002, when the Declaration of Principles on Freedom of Expression was adopted by the African Commission, it was a different scenario. The road that has been traveled so far has really been tremendous, although there's lots of challenges that we still face. But I just want to say that, you know, if you look at each and every country on the African continent, you find that there is an organization or there's a network on NGOs. There are several NGOs that are working on access to information as a human right in that country. And also, when you look at the continent itself, the continental body, the human rights body, which is the African Commission on Human and People's Rights, it's really has been rising up to the occasion and really showing up and stepping up in terms of providing guidance to states, in terms of providing guidance and developing standards on what really entails the right of access to information. If you look at the Declaration of Principles on Freedom of Expression that was adopted in 2002, there was a small section of that declaration which focused on access to information. And several years down the line, in 2019, the African Commission on Human and People's Rights adopts a revised Declaration of Principles on Freedom of Expression and Access to Information in Africa. And this declaration is a very progressive instrument that we now have on the continent that provides a guidance on what principles entail access to information. So there is a whole expanded section of the declaration that now looks at access to information, and it will give you different principles that define or explain the right of access to information that states can actually was adopted. The Commission had also developed a model on access to information for Africa. And this is an example. This is a guideline by the African Commission to say to the states, if you want to develop an access to information law, this is what it could look like. So it draws from international human rights and standards, and this was adopted in 2013. So some countries have gone on to incorporate some of the provisions of the model law, but in some countries they are yet to get to that position. So, and also in terms of some of the specific sectors or thematic areas, the Commission has also developed guidelines on access to information and elections, and we hope that the Commission will still be in a position to develop sector-specific guidelines that are similar to the ones that have developed on access to information. And we are also happy as well that the UN has also, since 2015 declared that 28th September of every year, we will be commemorating the Universal Day of Access to Information, where we take time to reflect on the journey that has been traveled so far, and also to reflect on some of the challenges that we face in advancing the right of access to information, and also reflect as well on the challenges that we face as we are looking at the right of access to information globally, and also the question that has been raised around transparency. I just want to point out that the governments or the government in a country is the custodian of the largest information that we have in a country or in a nation. And this is information around service delivery. This is information on budgeting. This is information on governance, a lot of issues. And some of the countries that we have on the continent do have the right enshrined in their constitutions. I know for sure that the Constitution of Zimbabwe has a particular section that is specific to the right of access to information, and this finds expression also in other countries as well. And access to information at its core, on its own, as a right, as a standalone right, is about knowledge, and it's about being able to use that knowledge. It's about being able to use even that information as a citizen, as an individual. So what it does is that it gives you the ability to enjoy other rights. For you to be able to enjoy other rights, you can enjoy your rights, with limited information, yes. But if you want to meaningfully enjoy the rights, you need access to credible information. Even if credible information is not there will always be information. But what we are speaking about today is access to credible information, because, information of all sorts, we are seeing it coming up, on social media, on different platforms, in different forms. So access to information there, but it's about access to credible information, which is important. And in this conversation, what we are emphasizing is that freely accessible, credible information should actually be the norm. It should be the rule and not the exception. And there is just a general consensus around the issue of transparency. That, transparency in decision making, I'm going to your question, transparency in decision making when public participation is very important, it's very crucial, and it depends on availability of information being made publicly available, information being easily retrievable, information being easily verified, and also it having information out there is very important because it lowers the barrier. It lowers the information barrier. It covers that information gap. And I'm talking about credible information. I'm sure we have seen, we have been hearing the World Health Organization talking about the infodemic. When COVID-19 hit us, there was a lot of information out there. There was overwhelming information, but what kind of information was it? There was lots of information, some of it which wasn't credible. And there was also a gap in terms of credible information. And proactively disclosing credible information closes
Sorry, Fungiwe, you are muted.
Yes, please.
You were muted for the last 30 seconds.
Okay. I'm not sure where. Okay, so just going back to the point about credible information being a facilitator of public participation and also helping in cultivating trust in government. So what we are emphasizing is a situation where information is proactively disclosed in simple formats that are able to be understood by everyone. So by everyone, I am also referring to the Declaration of Principles on Freedom of Expression and Access to Information in Africa. It has an express provision in it, a general provision on non-discrimination. And this is to say the right of access to information is a right that should be enjoyed by everyone, regardless of their status, regardless of who they are, regardless of their nationality, regardless of their economic status or any other determinant. So when information is in the public domain, what it also means is that, the public, citizens, journalists, academics, and any other person has, the ability to hold the government or public bodies accountable. It's very difficult to hold anybody accountable if you do not have the requisite, credible information. And this can only be facilitated by, proactive disclosure of information. So there is an obligation really on the part of there's an obligation on the part of government bodies and other private bodies to make the information publicly available and openly provides the information. I know with our access to information laws, there is a requirement for a process, not a requirement, but a process of requesting information where you go through a certain process to get information. But what the model law and also what is being advanced in the new declaration is proactive disclosure of information. That even before I as an individual approach as a public body to request for information, that public body or the relevant private body should be in a position to proactively disclose the information. It makes even it makes responses for information easier because you don't have to, a public body doesn't have to be responding, I mean, on a case-by-case basis to information requests, but it can just proactively disclose information at once for everybody so that those who require it are in a position to get the information timeously and also, but the situation that we are facing on the African continent really is that they are very, we haven't reached that level where we can say that all African countries have access to information laws. We are still very far, and it's not even half of the African continent that has access to information laws. And some of these laws that were adopted way back are now updated, are now outdated, and they need to be updated. They need to be brought in alignment to the international human rights law and standards also looking at them, aligning them with the model law on access to information for Africa. So we still have very few countries, really, if it's not half of the continent, that is very few that doesn't have access to information laws. And so even if the laws have been adopted in other countries, and some of the laws, if you look at the Liberian access to information law, is a very progressive law, the Tunisian one, the Nigerian one, not Zambia, but Malawi also has a very good access to information law. And but what is lacking, even if countries have the access to information law or they do not have the access to information law, there is a persistent culture of secrecy that we continue to witness on the continent. And where information is being disclosed, you realize that that information is not enough out there. There is scanty information. I mean, there is scanty information, which is not enough to hold the government accountable. It's not enough to hold, the public bodies accountable. So then in that situation, it creates, the need for whistleblowers to also step in and where, a lot of information is being covered up. We see that there is in some countries it's happening that whistleblowers are bringing up information which is in the interest of the public. But the problem, which is a very important component of access to information and also linked to issues around transparency, is the issue of whistleblower protection. We are still very far on the continent as far as whistleblower protection is concerned, and where there are efforts to blow the whistle, the consequences really on the whistleblowers have not been good, as we have seen that, in Zimbabwe, a journalist who has been speaking out on issues of corruption has been facing, several days or weeks in prison. And, that is not encouraging in a situation that purports to have a very, a democratic country, or having adopted an access to information law and a progressive constitution. And this is happening also in other countries. Although, there are countries such as Ghana. Ghana has a whistleblower Act of 2006, and it seeks to also encourage, citizens to blow the whistle, to bring information that is in the public domain, and this facilitate issues around transparency. But, the issue again, as I conclude, is that the culture of implementation, effective implementation, is still very low on the continent. We have very nice legislations for the countries that have adopted these access to information laws that promote transparency and also accountability, but the implementation levels are still very low. And we can decorate our legislative frameworks with such very elaborate pieces of legislation, but if they are not implemented, it means we still have a long way to go, and there is still a lot to be done, and a lot is being done.
Thank you so much, Hlengiwe. I'm really glad that you raised the issue of proactive disclosure of information, because that brings me straight into my question for Maxwell and Susan about what has the government interventions in Nigeria and Uganda been to fight COVID-19, and how strong, has the proactive disclosures of critical information been thus far? Maybe let's start with Susan, and then we'll hand over to you, Maxwell.
Okay, that's fine.
So I see ladies going first, and then the men will follow from behind.
And because we are gentlemen, we are not objecting.
Okay, then. Thank you very much. Once again, my name is Susan. I did not include the Juliet the other time, but I'm Susan Juliet Agwan, and I work with the Africa Freedom of Information Center. Allow me to turn on my camera. Okay, I think that's better. Okay, so thank you so much for giving me the opportunity to share on Uganda's experience in proactively disclosing COVID-19 information. How far have we gone as a country? given especially the fact that we have an access to information law and regulations as well in place. So in my discussion, I'm going to share on how it all started, the COVID-19 pandemic. And then when we got our first case in the country, what were government's interventions, and then and the interventions will definitely cover the proactive disclosure of information and whether as a country we actually got this right. So with the emergence of COVID-19 starting in 2019 and eventually opening up to so many countries in 2020, WHO had no choice at some point, and then it was declared a global pandemic. And I remember that immediately after the declaration of COVID-19 as a global pandemic, that's the time when the UN General Secretary, Mr. Antonio, stated that, you know, COVID-19 has proven itself to be another world war because of the way it was spreading like a wild bushfire, and the magnitude was very, very grave. So in Uganda, really, our very first case was detected in March. We prayed so hard while even our neighbors in Kenya and Tanzania had reported number of cases. But at some point, the prayers had to either work or not work. So in March 22nd is when Uganda registered its first case. And it was a male Ugandan, definitely, who had gone abroad, and upon return is when his temperatures were detected to be higher and eventually turned out to be COVID-19. So it's upon confirmation of that very first case in the country that the government immediately had to undertake different measures. Well, they were preparing to undertake these measures, but it was now time to roll them out. And there were a number of them. One, there was a ban on public transport. So this happened even before we had a total lockdown. So there was a ban on public transport. We're still going to work. People were still living usual lives with communications on how to protect yourself, wash your hands, among others. And then eventually we had to also get communication from government that public institutions and also private sector institutions had to limit the numbers of staff working. So more like at some point, some institutions had to start working in shifts to avoid contact and crowding. And as days went by, there was a ban on public gatherings, total ban on public gatherings, whether it is 2, it's 3. But of course, on practicability, we shall look at it in the conversation. And eventually government had to issue a total lockdown because by then the cases had gone to 5. And with the total lockdown also came a curfew that by 7 p.m. you had to be in your house, and it's only until 6 a.m. that you're allowed on the roads. And there was police and different security agencies to enforce that. And along the way as well, as the president kept addressing the populace on what's the progress, how many cases so far, how can we prevent the spread of COVID-19, among others, the president also had to issue a directive on the compulsory wearing of masks. How the information was received based on all the presidential directives, we're going to look at it. So access to information, my colleague has already ably shared the context. What is proactive disclosure? What is the significance of access to information if we want to realize all the other rights? So proactive disclosure, really, the need for it and the need for accessing this timely information, it exists quite highly, especially during crisis. Whether it's an economic crisis, whether it's a health crisis, it's very significant. And it's significant in that whether it is severe and affects the lives of people, they need to know about it because it's only through that that they're able to prepare themselves to respond. And governments themselves require this information because imagine government does not get these updates on how many countries have got COVID, which countries have banned public transport, among others, then we would not also have been able to prepare as a government. So really the need for accessing this information exists at all times, but most especially during crisis. And information also must be disseminated quite timely. And not just timely, because there is timely disclosing information which is not accurate. So this information needs to be timely and accurate and as complete as possible, because in the case of health crises like COVID-19, timely access to information has proven to us all that it's been the weapon that different countries have really used to fight COVID-19. Because imagine right now, we still don't have a cure to COVID-19, and people use the information available to know how to take care of themselves, among others. So in Uganda, when we talk about the government in the fight against COVID-19, it was really the Ministry of Health at the forefront. So it undertook measures to proactively disclose information on COVID-19. And with what they did then and so far, we do commend the government. There will be shortfalls along the way, but at least it was an opportunity to embrace information, because it was the only weapon that we had. And also remembering that it looked like COVID-19 had become an opportunity to disclose not just the discrepancies, but bringing to light some of the challenges that we had. For example, in Uganda, we have had a law since 2005. And the previous presenter rightly says that, we have the beautiful laws, but our challenge has been in terms of implementation. So we have had in the past challenges on implementing the act itself. Proactive disclosure of information is very limited, or was limited. But when COVID-19 came into the picture, you did not even have to request for information, because also I want to remember that during that time, it's now when we're in a total lockdown. So how many people would leave their homes to go to a public institution to reactively ask for the information? So it was sit in your house, turn on your TV, listen to the news, scroll your phone, and you would see updates everywhere. And suffice to note also is during the same time is when there was so much support, not just from government, but so much support coming from the population to the Ministry of Health, because of how it made efforts to disclose information on COVID-19. So we had numerous updates on the number of cases, how many contacts the person could have got close to. And then we had information on, you say government institutions, and not all of them had social media platforms for communication. I remember that it's at that point that the Ministry of Health boosted its communication on Twitter, on Facebook, on its websites, and information was eventually updated, because prior to COVID-19, we had historical data, which was not helping us. Okay, so we're not prepared to disclose so much information, but then here we are, we had no choice, we had to disclose the information. So information was available on different media platforms. There were press releases coming from the Ministry of Health, and there were statements issued by the ministry as well. And every time, I remember I said previously that the president had to address the nation, and many a times he made reference to, Ministry of Health for verification of his data. There were radio talk shows, jingles, there was dissemination of EIC materials, among others. Yes, we saw that. Emphasis again is COVID-19 was a reawakening for the whole country. And noting also that prior to COVID-19, I think it was 2 or 3 weeks to COVID-19 declaration in Uganda. Maxwell was in Uganda, and we were conducting a training on, access to information in the health sector. And this was a project that we commenced a year before. And during engagements, they shared what are the challenges that they face in terms of implementing the Access to Information Act, because we had done a study and ranked different health sector institutions on how much they disclose proactively and how are they faring in terms of reactive disclosure of information. Well, the findings were not very good, but it was an opportunity for us to sit down and share some of these issues. And I remember that Maxwell shared the experience of Nigeria and Liberia, the fight against Ebola. And whereas we have had cases of Ebola in Uganda, it was not serious as COVID-19 had now presented itself. And how did Nigeria and Liberia fight this, the Ebola? It was through, disclose information as and when, all the time, because remembering that at the same time, you're also fighting misinformation. If you don't give out the information, someone else is going to do your job as a public institution and disclose information which is not accurate. You would find people saying, you know, this concoction cures COVID-19, but how sure are we that it actually would cure? But because there was no information, people will definitely follow some of those instances. I want to briefly compare the situation in Kenya and Uganda during COVID-19 in terms of proactive disclosure of information. Whereas we tried, there were challenges in Kenya in terms of disclosing information, and also remembering the fact that we are a landlocked country as Uganda. So most of our goods have to go through from Tanzania to Kenya and then to Uganda. So whereas the cases were skyrocketing in Kenya, we expected them to hit high in Uganda as well. And I remember it was around July that civil society came together and sued the government of Kenya for failing to proactively disclose information. I also remember that was the same time there was a social media picture making rounds on how public officials in Kenya are stocking or preparing their homes for COVID-19. So instead of us preparing public, the health sector, the hospitals to manage the cases on COVID-19, it became very difficult. So we tried to disclose information, and we did not reach an extent whereby citizens had to maybe sue the government for failure to disclose information. In its disclosure, proactive disclosure of information, there were challenges. We cannot rule them out. They were there, and there were a number of them. It was a novel situation, not just for Uganda, but for everyone. And we were not prepared for this as a country. Prior to COVID-19, it's been a struggling economy, a struggling health sector, in that the beds are not enough. Either there are no ICU beds, there is no oxygen, people die while being transported to hospitals, among others. So given that it was a novel situation, and we were not prepared for this, it was a struggle to try to, you know, patch up all the errors here and there. And also the budgets, of course, because the time when COVID-19 started, we had already had budget approvals in the country. The national budget had been presented, and we're only moving into the next financial year. And what had been allocated to the Ministry of Health was not definitely enough to cater for the situation. And yet at the same time, we had limited funding to manage the COVID-19 pandemic. So government had to get into loans. And I remember that we got a loan from IMF, which was also misappropriated somehow. And up to date, we still have a case pending before the courts on the officials from the Ministry of Finance who misappropriated, alleged to have misappropriated the funds meant for COVID-19. And of course, there was misinformation and disinformation. So every day, the Ministry of Health had to wake up to either respond to a fake post, tell the citizens, you know, the information that was put up on our website was not accurate. There was, you know, at that point, they are also pirates, people posting information and also hacking onto the systems. So we also had those challenges. But of course, as the ministry kept boosting communication, then this information had to be disregarded by the citizens. But also, we had a number of people left behind. Whereas the ministry was communicating proactively, this information was largely in English language. In Uganda, we have very many local languages. We do not have an official language. And communication that the president used to make on the national addresses on COVID-19 were in English. So then people had to translate this information on their own. For example, if there is a local radio station in one of the rural areas in the country, the TV or radio hosts had to make their own translation of that information. And in that translation of information, they would misinform at certain points because they might have not understood what the president actually meant. The EIC materials that I was talking about that were disseminated by the Ministry of Health, they were also in English. So it was in the beginning, and the Ministry of Health acknowledged this error, that they actually did not have sufficient resources to translate the information. So different stakeholders had to come into the picture. Civil society, churches, among others, had to disseminate this information, translate it and disseminate in local languages for people to hear. But remembering that we also have persons with disabilities, how were these people supposed to get this information? So there was no translation of COVID-19 information in Braille, for example. And I also remember that at the inception of COVID-19, it was only one TV station that had deaf interpreters. So government then had to make communication to the effect that all other TV stations had to also have deaf interpreters for sign language for persons with disabilities. But of course, not all TV stations again would be able to incur this extra cost. So it was really only the main television stations that were able to do this. So we had some people left behind. Now, in the fight against COVID-19 also, we needed a multi-stakeholder effort coming from different people. I've been talking about the church, I've talked about civil society, and all other, the business industry, among others, all had to come into the picture. And I remember that at the start of COVID is when we also had a member, because AFIC is a membership organization, we had a webinar where we disseminated a checklist on COVID-19 information that should be proactively disclosed. Because at that point, government alone was not going to do this if no one else was going to come into the picture. So we discussed the role of access to information in responding to crises and sharing different experiences from different countries on how far, because by the time COVID came into Uganda, other countries had already recorded even deaths. So they were sharing experience, which we also shared with the Ministry of Health. And we have continued to have engagements with them on what kind of information do people need to see out there. So the question, as I come to the conclusion, is, did Uganda get it right? Have we managed the pandemic this far? It's been a learning experience, really, for us as a country. And what we have done may have been the right thing, but also there's what we have done which was not right. So we as a country continue still to engage with governments to improve on disclosure of proactive information. And given that right now we're going into elections, there's been disregard of the SOPs, the standard operating procedures that have been disseminated by the Ministry of Health, because we have been used to a local system of campaigns, and now we're here agitating that people should campaign virtually. So that is also still a challenge for us as a country. So we need to prioritize really the health sector, that we don't need to wait for pandemics to respond, but government needs to respond before even pandemics arise. So far, as a country, as of yesterday, we have confirmed 25,000 cases of COVID-19, and these are Ugandan citizens. So I have not added maybe the truck drivers who come into the country and any other foreigner who has been detected with COVID-19. So standing at 25,000, we have also registered a cumulative recovery of about 9,510. And contacts listed so far as of yesterday is also standing at 48,750, and the samples tested this far as of yesterday is 660,758 cases. Every day as we wake up, they're now doubling numbers, because initially we would wake up to 20 cases of COVID-19 in the country, but starting the other day, we wake up to 700 cases of COVID-19 in a day. And this information has been disclosed by the Ministry of Health. No matter how scary it is, the information is out there for us to act. I will end with a quotation from the Minister of Health, which she disseminated yesterday. And she said that death due to COVID-19 is now closer to your families than you ever imagined. It will soon be a matter of life and death if we do not rethink our behaviors as citizens of Uganda. So I'm making my final plea to everyone here that please wear your mask. COVID-19 is no joke. We still do not have a cure to COVID-19. Thank you very much. That has been the experience in Uganda.
Thank you very much, Susan. I think for everybody outside of Uganda, it was a lot of information that you shared with us, and it's very, very interesting to hear what the initiatives by government has been, in spite of the fact that, you know, sometimes we think it's not the right way to go about doing things. But I think government at every turn has done its best in each country to be proactive and disclose information as much as they possibly can. Maxwell, we're now curious to hear from the Nigerian perspective. What is the experience been like on your side, and to hear more.
Well, thanks a lot, Commissioner, and thanks to the presenters before me, Lengiwe and Susan Juliet Agwang, whom I like to call our boss lady ATI at EFIC in Uganda. Boss lady Liga, yes, in terms of ATI at EFIC in Uganda. And they've essentially made my job a lot easier by setting the tone and dealing with some of the critical issues. Instructively, just before I switched to Nigeria, I just want to remind you that it was quite fortuitous that we had the training. I think it was about the middle of March for not just the Ministry of Health, but all parastatals under the Ministry of Health in Kampala. And incidentally, I remembered I was not feeling too well then, and I kind of joked that if at that time things were the way they were now, maybe I would have been quarantined for COVID, while doing the training, and everybody laughed about it. But it was at that time, the mood in that room wasn't one in which people thought that COVID was going to have a landfall in Uganda at the time. But we kept using it as the example to drive home the point of proactive disclosure in the context of a health crisis, even though at that time it wasn't seen that the pandemic was in Uganda. And so it was instructive that shortly after that, it made landfall, and then the lessons from the training became useful for the health ministry and all the parastatals under the health ministry. And it's instructive and useful to learn that the health ministry actually turned a new leaf and they found it useful, and then they deployed as much as was possible. And the rest is history now in the context of Uganda. So I guess that's useful learning within that framework. In the context of Nigeria, coming home more specifically, it's been a mixed bag. Like Juliet referenced in her submission, while doing the presentation in Kampala, the example one could give was using Ebola, because we had the experience of Ebola in Nigeria. And then not just in Nigeria, but in the Mano River Union countries. In West Africa, you have the Mano River Union cluster, which is Sierra Leone, Liberia, and Guinea. And that's where we had the onset, starting from Guinea, of Ebola, before it then came to Nigeria through a Liberian, Patrick, I think, Sawyer at the time. And so we kind of learned a lot, although it wasn't done. It didn't start off systematically, but the value of proactive disclosure in terms of managing public health crisis, that was our first experience in the context of Ebola. So that was the closest experience we had when I was doing the training in Uganda. But in the context of Nigeria, that experience became useful in the context of the COVID-19 pandemic, because during the Ebola crisis, what was happening then, even though we had the access to information legislation, like Commissioner, you pointed out in your submission of the Nigerian context, enacted in 2011, but it wasn't the case that proactive disclosure was something that had been internalized, including by the health ministry officials. So by the time we then had the landfall for Ebola here, the Ministry of Health then, under the leadership of Professor Yeguchi Chukwu at the time, took on a default position of engaging the public proactively twice daily. First thing in the morning at 8, last thing in the evening by close of business at 6, to update on what had transpired overnight and then during the day in the context of Ebola. And the difference was, at the time, it was new, it was strange, because that's not something that we're used to in the context of Nigeria, where rather government officials actually manage information and see information dissemination as a public relations strategy. So they would only give information that will make the government look good and massage out all of that information that they think will make the government look bad. So, but that was the first time where you had proactive disclosure of information in a way that the public wasn't used to. One, in terms of its regularity. Two, in terms of its integrity, you know, and 3, in terms of just setting the record straight and putting the facts and figures before the public. And that helped quite a bit. So fast forward now to the COVID-19 pandemic. There was a presidential task force that was set up under the leadership of the Secretary of Government of the Federation. And that task force now took it on itself, and it's still happening till date, you know, to have regular daily briefings, although theirs was once a day, usually in the evenings, on national television, where they also have media presence. And it wasn't just the Minister of Health, as was in the case of the Ebola, but this was a retinue of different federal cabinet members, of federal ministries, and then different key stakeholders, including the leadership of the National Center for Disease Control, as well as the Secretary of the PTF as well, and then several other key stakeholders will be present, where they would update on developments in the course of the day and the night before, and then take on questions from the media, you know, in terms of what the gaps were, what the challenges were, and any critical issues that needed dissemination for information to the public. So that became a ready go-to place in terms of just information dissemination for the public on what the situation was with the pandemic, not just about the number of positive cases or the number of deaths or recoveries, but information about the general context as well as what government is thinking. And then when issues around what is going to happen, when they needed to extend the lockdown, when they needed to partially review some of the measures that had been put in place, lift some of them, reinstate some of them, all of that information became very useful using that medium, you know, as a contact point for the public, and information that at the minimum was in the eye of the public fairly authentic. And so that was the practical framing in terms of proactive disclosure of information across board in the context of the management of the COVID-19 pandemic. Now, could the government have done more? Of course, certainly. But again, given where we found ourselves, it was also a learning process. So yes, they tried to build on the experience of Ebola and then did that in a lot more systematic fashion. But again, there were also challenges. And why do I say could the government have done more? And there were also challenges. If you look at what happened subsequently in the context of the demonstrations, which happened more recently in the EndSARS, I'm sure some of you would have seen the hashtag EndSARS protest, you know, which also subsequently snowballed into attacks on storage facilities that house some of the COVID palliatives, because in the context of the COVID pandemic as well, private sector came together to pull resources together to assist the government to provide essential consumables that were also required to kind of enable the downtrodden, manage the impact of the lockdown on the downtrodden. Now, and these were huge amounts of money that were deployed to purchase these consumables and were supposed to have been disbursed or distributed rather, you know, to all, to categories of persons that fell within the threshold that needed that kind of support. Now, it then emerged from the aftermath of the EndSARS protests that a lot of these palliatives that were distributed to the states at the level of the states and even at the Federal Capital Territory where I am now, were actually not even distributed to those that needed them. So some bits were distributed, but the bulk of it were still kept in these warehouses. And that created a huge scandal and a huge crisis, because you then had members of the public going to those warehouses, breaking into them and taking the materials themselves. In some instances, they were not the palliatives, actually, they were agricultural products that had been preserved with pesticides for actually the next planting season, but nobody bothered about that. But what that then showed was that there was not, in the context of this distribution of the palliatives, there was not enough information dissemination, because the question that then was being asked was, how was it the case that these palliatives were supposed to have been distributed to the downtrodden? They were not. They were stored in these warehouses. And then the chief executives of the state, the governors, claimed that they were looking for the most opportune time to distribute the palliatives, and yet people were hungry, you know, because with the lockdown, which lasted for several months, the economy ground to a halt, and lots of people who lived on daily sustenance could not find ways of sustaining themselves, and that created hunger and intense poverty in the land. And so when I say, could the government have done more in terms of information dissemination proactively, that's an example. So it wasn't just talking about the protocols for managing the pandemic, but also the social services that were supposed to have been provided as ways of cushioning the effect of the lockdown. The information around that also ought to have been disseminated proactively, and that was not done. And that also created a situation where corruption first actually had the order of the day, and then lots of all of these other things now happen. And what that also then did was also to undermine confidence in the system that was already in place for proactive dissemination of information, because what the public started feeling was there was selective dissemination of information. So the government just did that which they thought was the norm, and then the critical information that the public also wanted from a socioeconomic perspective in terms of getting access to the palliatives that the private sector had put together was not disseminated robustly, and that then created a crisis of confidence. So that's a classic example when we say the government could actually have done better. But I don't want to rehash the things that my colleagues have already said, because I think they also apply across borders in very many respects in different parts of the continent, Nigeria included. So I would also align myself with the point that they've made. Thank you.
Thank you, Maxwell. I love how, as you and Susan speak, I think because we've experienced something very similar in South Africa, we literally understand and almost can put ourselves in your shoes as citizens in the experience as you tell us your story. So moving over now to Botswana, which is obviously, you know, the country that does not have the access to information law in place. We have Botsetso waiting patiently, I know, to tell us about, you know, what has been the historical development in terms of the law, and, you know, where is Botswana currently? And in addition to that, if you can also just take us through the proactive disclosures by government during the pandemic, and kind of round it up so that we have almost that comparative analysis in the back of our minds going on between the three countries. Thank you, Botsetso.
All right, thank you. Thank you very much for having me. And good afternoon to my co-panelists. Wow, indeed, for Botswana, it has been quite a journey when it comes to access to information, freedom of information legislation. Let me just maybe highlight that when it comes to oversight bodies in the country, and when it comes to the state media, most of them are under the office of the president. Some would argue and say that that's for probably speedy, I guess, delivery of services by those institutions. But when it comes to state media, one, you know, could argue that it's one way maybe the executive or government wants to regulate what goes in with the state media, and in doing so using that big instrument to control by a few what people get to know, and what people get to hear, and how they interact with information. So when it comes to the access to information law, in 2008, government introduced the Media Practitioners Act, which was rejected by some who argued that the act would restrict the freedom of the media, where Section 6, for example, requires that journalists be accredited by an executive committee. And people were worried that doing that would actually push for some people or for some journalists who maybe would report, against or report some truths against the government not be accredited and therefore not practiced. So this was in 2008. They've been trying to repeal this Media Practitioners Act. And even the current president promised that the act will be repealed. And they discussed it in the last winter session, and government rejected the repeal of the act. But when it comes to the freedom of information in 2010, a member of parliament from the opposition party introduced the Freedom of Information Act in parliament, which was rejected by the majority. The bill was later, brought on the floor of parliament in 2015. It was rejected again by government, saying that they had some secrets that they needed to keep, and that they will introduce a similar bill that will take into consideration how they keep those state secrets, I believe, and I guess how they safeguard national security, which brought to I guess to the society the importance of knowing what national security is all about and what people believe as national security. So we've been having discussions of what national security is and what emergencies are. And with COVID now, it actually highlighted the importance of citizens engaging with issues of security and how the security sector really works and how government can use national security for certain narrow interests of a few. So in 2015, it was rejected. This year, it was discussed and brought to the floor of parliament by some member of opposition, and it was also pushed to be discussed at a late date by government, that there are some important issues to discuss than issues with the, for example, the Media Practitioners Bill, and that government usually willingly give out information on certain issues of interest. But the question is, with some issues, if I determine that I want to know some things, I do not have a legislation to use to actually compel my government or the state to give me access to that information. So this is the journey, really, in short, of what has been happening when it comes to access to information laws in Botswana, freedom of information in Botswana, and that government would agree that the laws are needed, that they're important. But I guess it depends on where they come from and when they are ready to bring the laws on the floors of parliament, and whether or not they speak to whatever they see as public interest. For 10 years now, I guess we've been going back and forth as government, as civil society, as opposition in parliament, trying to bring the Freedom of Information Bill to life, but to no avail. That it has been rejected now for the third time in 2020. The Minister of the Presidency, Kabo Morae, rejected the bill, saying that they are going to consult the media. Even though the media has written, even the trade unions and civil society have written statements supporting the repeal of the Media Practitioners Act. And I believe we want to start with the Media Practitioners Act because at least there is a legal framework that speaks to the freedom of information, at least the freedom of practice by media practitioners, and then grow from there, and I guess build from there. The private bill that was tabled by Honorable Dumelang Saleshando in Parliament, that one may really take time until government or the ruling majority determine that it is time to bring it to the floor of Parliament, as we have seen recently in the different sessions of Parliament, that most of the bills that are tabled by private members are usually rejected if they don't speak, I guess, the same language, even if it's from best practices, the bills based on best practices from other bills outside the country, or even based from international convention, they have been shut down by government. When in the last session, when the repealing of the Media Practitioners Bill was tabled, about 26 members voted against the motion. And maybe I need to just highlight that our parliament, we have about 57 members of parliament with 6 specially elected members of parliament. And of those, we have 17 ministers, so forming the executive, and then assistant ministers. So in a way, you have what, about 34 cabinet members who would vote, who form part of parliament. So when it comes to really pushing bills and voting for or against, the ruling majority already has about 34 members who would collectively take responsibility and vote with their party, for example. So if only 15 members agreed to repeal the Media Practitioners Act. Let me highlight that the opposition, we have about 20 members of parliament from the opposition. And out of the 63 members of parliament, 22 abstained, they were absent. So they didn't vote on the act. So we're still in a dance, basically, when it comes to access to information. But maybe let me link that to what has been happening with COVID and how government has proactively shared information. For the first time, COVID, I guess I'll say, it has brought both good and bad. With us now, the good being we've had to have Parliament broadcast live on our televisions, on our state media. We've had to see our members of Parliament, deliberate and represent us. We have had to, from that and how people responded and how they loved it, government took advantage of that and established a session on the Botswana television, which is called COVID-19. And with that, we have daily updates of what is happening with COVID. The numbers of positive cases, recoveries, deaths. Unfortunately, we were not hard hit by COVID like other countries. So that has been really, really a good thing. So I really don't know if the situation was different, if government would be so open with the numbers and with the situation publicly on TV. And I think maybe because we're relatively doing so well in terms of response and in terms of the numbers that don't really grow and people not really losing their lives, government is open to share. I could be wrong, but I can't really assert, concretely that the proactive disclosure comes from political will, because we've also seen how with, say, a relief fund, some information is not openly shared. So when it comes to Botswana, really, with access to information, it's a dance, it's a journey. We're still negotiating as civil society, as the media, as the public, that the laws need to be put in place. If our constitution gives us, the right to information, the right to ideas, and the right to opinions, then there must be an act that speaks to these rights, and it must be based on best practices. And let me just link what access to information laws would do and how it would benefit citizens when it comes to issues of pandemics, for example. If say there was if there were information that we needed to know as citizens, and government decided to keep it a secret under, say, the ambit of national security or state secrets, for example, we wouldn't be able to take our government to the courts to compel and ask government to give us the information that is needed, maybe because we see other countries, responding differently to the pandemic, for example. But I mean, I always say that in Botswana, our democracy is being tested. Our democracy is being tested in that everything before used to just happen, and we used to trust our governments that they will do what is best for us. But we see that things are changing. And as we push and we ask for information that they usually don't routinely release, it becomes, sometimes it's like, but why would you want that information? Who is making you ask for that information? So in a way, as we're being tested and as our democracy is being stretched, we can't really say we're failing too much, because it's the beginning of the stretching. But it also means civil society needs to be strong enough to really stretch and be able to accommodate when government refuses or when government agrees, because then it requires, for us to take some form of responsibility in informing citizens and empowering citizens on what to ask and how to ask and when to be worried when certain information is not made, publicly available to them in time or on time for certain decisions to be made. Thank you.
Thank you, Putsetso. I think you're quite right in that closing remark that you just made about the role civil society organizations have to play. And it really is a stretch, and it is, pushing the boundaries and holding government accountable and calling on the role players to disclose the critical information that, citizens need to have access to. And I think rightly so. In terms of that, I just want to go back to another question, and maybe we can start with you, since you're right here.
Sure.
Just to close off quickly, I want to just understand, and you most probably have about maybe 2 minutes just to round it up for us, but give us a sense of, has there been a human rights-based approach that has brought in more stakeholders? Maybe not in the beginning, but as we've gone through as part of the stretching exercise that you call it. And have you seen stakeholder participation increase? Once you let us know, we'll move over to the other panelists for their opinion as well.
Okay. I mean, COVID has really done wonders. I mean, it's unfortunate that, some lives have been lost, but what it has done to democracy for me, in my opinion, is that it has forced us to look to the next pillar we can hold on to, because it really shook us. And as civil society in Botswana, we had to really force for government to open the space for us. When it happened, as a coalition, we came together as civil society organizations and said, okay, government is doing 1, 2, 3, 4, 5. And they report and say that we are part of it, because governments, and I could be wrong, but our government has a tendency to say, oh, civil society was represented, we consulted civil society. When they talk about maybe someone from a secretariat of a council of NGOs, or a secretariat of someone from the secretariat of a trade union federation. But this time around, as a group of organizations, we said, but where can we come in and how do we engage with government? But we wanted to engage with the government by bringing value. So where for example, when they restricted movement and we couldn't go to the shop, we couldn't sell, most of the informal workers who couldn't sell their sweets outside on the streets, they couldn't make any money, and they couldn't get food packages from government. So as civil society, we then sought care provisions from businesses and went around and donated those care packages. But we were also then given I guess, authorization, because we couldn't travel or leave the houses without permits, by the Ministry of Health, to help the Ministry of Health go and deliver those care packages. I will just give an example of illegal migrants who were outside the I guess, social protection programs, who some were living by the dam, some were almost starving. Civil society then came in from a human rights perspective and said, you cannot let people starve on our land, on this land. We cannot let people starve in our country. So we then came from government seeing that importance of human rights and right to health, but also right to food, because it meant if you couldn't go to the shops. So we, I think as civil society, we helped government see that importance of using a human rights-based approach to COVID. When it comes to citizens, government did what it needed to do. The state took upon itself as a responsible state, recognizing the rights of the humans, you know, within the boundaries of Botswana, to provide you know, care, to provide security, to provide all that the state needed for her citizens. So yeah, so definitely yes.
Thank you for that. Can I maybe move over to Maxwell quickly? And Maxwell, if you can use your 2 minutes to talk us through the human rights-based approach and how, you know, broader stakeholders were brought in.
Can you hear me?
Yes, we can hear you now.
Okay, all right, thanks. Very quickly, I think in some form, one of the opportunities that COVID brought is in the context of socioeconomic and socioeconomic rights more broadly, because in the context of Nigeria, issues around socioeconomic and rights are contained in Chapter 2 of our Constitution. And they are usually defined as non-justiciable, which means they are not enforceable in court. And the overriding principle is that of progressive realization, as different from Chapter 4, which contains the civil and political rights, which are defined as being justiciable and enforceable within the court system. And you would find that all the measures for containing COVID actually fall within the socioeconomic rights framework, you know. So ordinarily issues of justiciability and progressive realization become critical, you know, but in the context of COVID, it then made these issues of these rights front and center in terms of government now being under pressure to see what can be done to advance the realization of those rights, whether it be the issues around the right to health, the right to food, right to a safe and healthy environment, and the lot, you know. So that has changed the narrative in some form. And then I would also use the opportunity to just clarify, because I noticed in the presentation you made, Komeshini, on the Nigeria situation, you did say that the right to health is not protected under the Nigerian Constitution. That's not exactly correct, because if you look at Chapter 2, more specifically Section 17 sub 3C and 17 sub 3D, when read together, one talks about issues around safety and welfare of all persons. The health, safety and welfare of all persons in employment are safeguarded and not endangered and subject to abuse. And then the other talks about that there are adequate medical and health facilities for all persons. Now, when read together, that in some form provides for some protection on the right to health. And then when you then take, again, just to segue into what will be my next question, but just to use part of my 2 minutes to also address this, that's the basis. So when you then look at the provisions of the National Health Act 2014, it then seeks to also give effect to those relevant provisions of Chapter 2, which necessarily then makes them justiciable. You know, so in some form, it's right to then say that rights that are in the bracket of socioeconomic, cultural rights that hitherto were looked at as another cluster of rights which do not have the same level of visibility as civil and political rights, have now benefited from the aftermath of COVID, you know, and making issues around providing the right to health facilities and all of that, now making government to take them a lot more seriously. And more importantly, even providing for those that fall within the lower income bracket, you know, so government is now taking more seriously issues around small and medium scale enterprises, issues around those who are in the informal sector, issues around providing for them and providing safeguards, and then also taking more seriously social safety nets, you know, that even if government said they were doing before, they essentially were paying lip service to them, you know, so scaling up the attention on social safety nets for the downtrodden, again, which falls within that bracket of socioeconomic and cultural rights framework, is now giving the kind of visibility that it did not have before now. But of course, allied to that is the big issue around transparency and accountability, which is what the access to information regime also seeks to engender. But that's also become a major part of the discourse, because citizens are now more than ever before insisting that government must be transparent in terms of what it has done, what it is doing, and what it proposes to do in the context of managing the aftermath of the COVID pandemic, particularly in the context of public budgeting and resource allocation to deal with all of these challenges. So that has now become ever more important, and government is coming under a lot of pressure to disclose information proactively in the context of public spending and have accountability in terms of being able to explain, you know, all it is doing with public resources that are meant to address COVID and the aftermath of COVID.
Thank you, Maxwell. Thank you for the references as well, just to make sure that our findings are perfect, as always. And finally, Susan, if you can share with us the Uganda side of the human rights based approach regarding health and the pandemic, and you know, just to quickly close off and looking at, you know, stakeholder participation in country.
Okay, thank you again. Like Maxwell noted previously, that the circumstances and situations in countries are not very unique from each other. So we really share experiences. And you noted previously that our constitution does not expressly provide for the right to health. Yes, that is true. But I would like to note that it has not hampered the implementation of the right to health in the country. Because despite not expressly providing for in its operational provisions that every Ugandan has a right to health, it protects this right within other articles of the Bill of Rights. For example, it talks about clean and safe environment, talks about infectious diseases, you know, women, children, persons with disabilities, and minority groups. The Constitution also protects, it emphasizes rather, government's role given the binding instruments that it has ratified to. So if government has, for example, ratified to CEDAW, why would it not implement commitments under CEDAW? We also have various policies in place in the country, speaking to the right to health. The National Development Plan, among others, address issues of the right to health. But when we look at practice, when it comes to implementation of some of these, it's only until now that I would say that we can speak with pride that we have tried so much, because we have no choice as a country to implement certain things. And I will point to, for example, public participation. Whereas prior to COVID-19, it was minimal. Now we at least see a public participation in government's efforts to manage the pandemic. But noting still that that is not sufficient enough. Our constitution provides for a right to participate in government affairs, but many people do not know that they actually have a right to participate in some of these issues. Or at gunpoint, to ensure that we account for COVID-19 funds. I will speak directly to the Ministry of Health. So much money was allocated to the Ministry of Health to manage the pandemic. And it's reached a point that, you know, when information is not disclosed out there proactively, for example, procurement plans, because during COVID-19, it was now emergency procurements. But noting that emergency procurement does not disregard the need for transparency and accountability as a government. So there was information out there on this money has been misappropriated, or it's not actually being used to do what it's meant to do. And when such information gets out through the private media, then government had to come out and make clarifications. And I remember that the Ministry of Health, and I think it was the first time for me to see a televised accountability of all the COVID funds that they had received as of August. So it was aired on TV for everyone to hear and see on how much, because really so much had been received, especially from private individuals, different companies, organizations, businessmen, even private individuals contributed money and so much more to the fight against COVID-19. And COVID-19 has also, while exposing government's ill preparation in the health sector, it has now presented opportunities for broadening the health sector. For example, there have been promises too, and we only hope that time will tell that it has been implemented. There have been promises by government that because of COVID-19, we realize that the health sector individuals, the nurses, the doctors, the men and women in the front line have been the sole source that we have relied on to manage COVID-19 when it came to the hospitals, clinics, among others. So there have been promises to, government is going to focus more on the health sector, and we hope that this will come to pass. There have been promises on increasing their pay, because you can imagine if a health sector nurse earns about, let's say, 300,000 Uganda shillings, there's no motivation to be at the front line. After all, you're earning little money. So there have been promises to the effect that we shall have these things improved. We've also seen hospitals being improved. I remember just last month, there was a communication from the Ministry of Health that it had purchased more ICU beds, because in the country, if you went to a country, for example, you'd find that a national regional hospital has maybe 2 ICU beds. Now imagine we have 20 people who need to use these ICU beds. It becomes impossible. So those are the opportunities that we've seen that COVID has presented in terms of human rights.
Thank you, Susan. I would like to take this opportunity now just to thank all of the panelists that have joined us today and extend my deep thanks for your sharing of knowledge and information and giving each of us a glimpse into your countries. And it is really much appreciated. I think all the participants on this webinar are now most probably tired of hearing us all speak and looking forward to just watching the toolkit showcase. So without further ado, we are going to share the video followed by the posters that represent each country. And what we really, really are hoping for is that any civil society organization that is interested in using the video and the posters to campaign within their country should contact either us directly or Sipesa, which would be Ashna Kalamira, in order to get access to the video and the posters. So in a few minutes, you'll be able to view both the video and the posters.
Governments and other parties must be held accountable when developing policies, conducting programs, and creating redress mechanisms for victims of health violations. In public health crises, the privacy of patients is a justified Access to information or freedom of information refers to a citizen's right to access and receive information from the government. These laws provide a duty on the government and a right to the citizenry. International best practices dictate governments, public bodies, and parastatals should provide access to all information generated. Access to information forms a core principle of the African Declaration on Internet Rights and Freedoms and provides that any information produced with support of public funds should be made freely available, including on the Internet. Access to information and the right to health are closely linked. The World Health Organization, WHO, emphasizes that a human rights-based approach to health should be adopted. The WHO advocates a human rights-based approach requires meaningful participation. Participation means ensuring national stakeholders, including non-state actors, such as non-governmental organizations, are meaningfully involved in all phases of programming, assessment, analysis, planning, implementation, monitoring, and evaluation. Governments must allow civil society to participate in all phases and measures adopted. Furthermore, governments and other parties must be held accountable when developing policies, conducting programs, and creating redress mechanisms for victims of health violations. In public health crises, the privacy of patients is a justified reason to deny access to personal information. Anonymized information should be proactively disclosed to allow for rapid responses and initiatives by civil society, public health experts, policymakers, and the broader public. With the proactive disclosure approach, there are additional restrictions that apply, including confidentiality and the protection of national security. With COVID-19 regulations, physical contact tracing entails public health workers visiting infected individuals to obtain a list of all the persons the infected individual has come into contact with. Compulsory logging entails all physical stores, restaurants, and grocers use paper records to hold varying amounts of personal information. Mobile applications automate the contact tracing process. The rise of contact tracing applications and databases such as Be Safe in Botswana, Rapid Trace in Nigeria, and Call the Clinic in Uganda. Contact tracing apps may assist governments in tracking COVID-19 infections by tracing people who have come into contact with an infected person. Such people may either be quarantined, monitored for symptoms, or tested for the virus. The evaluation of access to information in African contact tracing applications and databases highlights the following concerns. Applications developed by public and private bodies create concerns for the accountability of the application owners and the security of the data. Applications have inadequate privacy policies. Some governments have not specified that use of personal information is limited to the purpose of contact tracing in their regulations. This can allow for human rights violations, and no supervisory bodies have been created to monitor the applications and databases to ensure that human rights are not violated. Why is access to critical information in a contact tracing database important? Without access, civil society cannot uphold democratic principles of accountability, transparency, openness, and access to justice. Civil society should hold the government accountable to the citizenry and ensure the use of contact tracing applications is limited to the purpose for which they were originally intended, to help minimize the spread of COVID-19. Multiple international civil society groups, like the Red Cross, have cautioned against scope creep, which could lead to unnecessary and unwarranted use of the information collected. Civil society should have the ability to monitor the effective implementation of this technology to ensure a human rights-based approach. Civil society can ensure openness in the use of contact tracing data by monitoring the interactions between government and the citizenry, and government and the application developers. Transparency by government is required so health-based civil societies can access the database of critical information and analytics generated to inform actions and responses taken by the organizations. While these principles are enshrined within access to information laws, the laws themselves lack effective implementation. Civil society can fulfill the role of protector of human rights by creating the requisite awareness through campaigns, programs, and roadshows. Building effective implementation on the ground includes knowing if your country has an access to information law, understanding the mechanisms available in law, understanding how this impacts the public and private sectors, knowing what the processes are for requesting information and the grounds for refusal, understanding the costs for the citizens, creating awareness around how to use legal mechanisms for citizens. Now that you know, how will you use this information? This video is brought to you by EndCode and CPESA as part of the African Digital Rights Fund.
So that was the video that has been compiled in order to promote advocacy and create the requisite awareness. We will now share with you the posters, and the order of the posters will be Botswana, Nigeria, and then Uganda. So just to talk through the posters quickly and give you a sense of how we came up with this. What we looked at was the Constitution and the legislation in the little table, and we specifically looked at access to information and the right to health, and answered yes or no according to what we found. So we have made mention of the fact that Botswana does not have an access to information law, but that there is sentiments towards drafting one. Based on the discussion that we've just had, we've seen there isn't really a duty to disclose. However, the government proactively engaged in disclosure of information, and participation in all phases of the response was definitely not seen. In terms of the contact tracing app in Botswana, there are a few pointers that we wanted to highlight, which was you need to have a smartphone if you were to use the app. It needed to be, it was not primarily downloaded by many people except young adults. Paper records were preferred and more commonly used. And currently the BeSafe app is in court. There's litigation over the privacy concerns and the security of the application itself. And currently the use of the app is not compulsory. Moving over to the Nigerian poster, once again, there's the table at the top that talks about access to information and the right to health. And you'll see, Maxwell, you'll be happy to note that we've got a yes under all of the blocks, because we have acknowledged that even though there isn't the direct, there was an error on our side in citing no direct mention, we do note your comment from earlier. Then as we go further down, we've tried to kind of keep the format of the posters the same, but due to different things in different countries, the posters differ slightly. So once again, has Nigeria adopted a human rights-based approach to health during COVID-19? Public Health Act adopted, that was yes. There was a duty to disclose. Did the government proactively disclose? Absolutely. And was there participation in all phases of the response? And that's a no. Once again, we've got the Quarantine Act mentioned and the Infectious Diseases Bill. And we have said that currently there is no government application that's mandatory, and the citizens have the option to choose from a few privately owned applications. And finally, moving over to Uganda, once again, the table gives you a sense of access to information and the right to health. And then we go down to the human rights-based approach to health during COVID-19. And like Susan did inform us earlier, there is a duty to disclose. Government has been proactively disclosing, but once again, not full participation in all phases of the response. In terms of health information system requirements, there is a health knowledge management portal. So there is a central repository of health information, which was developed under the e-health strategy. And once again, is an example of proactive disclosure of health data. And in terms of contact tracing in Uganda, the applications exist. There's no mandatory government application that's advocated currently. And of course, once again, paper records are primarily used. So coming back to just rounding up, I think we all are in agreement that COVID-19 is still going to be around for a long time to come. Civil society organizations need to be aware and concerned about how they continue to engage with government around the use of health information and access to that information. As of yesterday, the South African government has officially disclosed that South Africa is officially in its second wave. And I think as citizens enduring the pandemic, each of us does carry that duty to do our bit in order to curb as best as we can the spread of the COVID-19. And I think that this might be one way to play a role in how we tackle the pandemic. Once again, I'd like to say that should anybody require access to the video and the posters, to kindly contact EndCode or CPESA, and we will ensure that you receive copies and access to both. And should there be any questions right now, we're happy to take those. If there are, you're welcome to submit them over the chat, and we'll just give you a few minutes to pick them up and address them. But once again, I'd like to say thank you to my panelists for their very insightful commentary, and to the participants that have stayed with us through this webinar. Thank you very much for your attendance. I'm just going to check the chat quickly, and if there's no questions coming in, then we can close off. Okay, I don't see any open questions currently. Thank you, Peter Msimanga, for your time. And I wish everyone a good afternoon. Thank you very much. Bye-bye.
Thank you.
Thank you.